I'm joined by a man, and David Edgar Love is on my telephone. David!
Hello, Mark. Pleasure to be here.
I mentioned your name, and I think anybody who follows along in the recovery world knows your name because of the work that you do. And I'm glad to get you on the show tonight because you're involved in a number of issues involving a treatment program called Narconon.
Yes, I was, and I still am, in helping to shut them down in several places. Yes, that's correct.
Amazing. I have raved for years on the air about this. They used to have one of the largest treatment centers in the world located in Trois-Rivieres, Quebec. Yet you single-handedly seem to have gotten them shut down and thrown out.
Well, it wasn't just me, but I guess I was instrumental in doing it for sure. I did submit 3,700 pages of evidence documents why they shouldn't stay open. The Quebec government brought in new regulations, and I helped them and to direct them to the points where Narconon could not meet what they were stipulating they must meet. So the health department shut them down before somebody did die, because 3 people just died in a 3-month period while Narconon was still open in the Narconon Arrowhead flagship in Oklahoma. In fact, one of the anniversaries was today of one young man who just died. His name is Gabe. So they're bringing people out of Narconons, Scientology drug rehabs in coffins is basically what they're doing.
David, give me a little bit of your history. How did you end up involved in this?
Well, I was in Vancouver, and of course, Vancouver is a big drug-infested city, of course, the East End, not unlike Toronto's, some of the areas in Toronto.
Mm-hmm.
I had several back surgery. I was addicted to heroin and cocaine. I was on the methadone program for 5 years at a very high dose of 180 milligrams, and I was trying to get off. I was trying to get off, and I couldn't. The rehabs wouldn't even take me because it was too dangerous. Are you still there?
Right. Yes, I am.
So I had no other choice but to go to the legal injection site, and I thought, well, what I'll do is I'll take a bunch of clonidine to lower my blood pressure. I'll take some Valium. I'll inject heroin, and I'll be rushed to the hospital because there's nurses there.
Mm-hmm.
So they rushed me to the cardiac ward, where my heart stopped, of course, because my blood pressure was so low. And I stayed in the cardiac ward for 10 days, and I said, do not give me any more methadone. You can give me a little bit for pain of whatever you want, but don't give me any methadone.
Right.
And then my heart stopped again, and I made it out okay. 10 days, and they sent me to the Vancouver Detox. The Vancouver Detox has a good system there. People that go in there for heroin, which is the main thing there.
Right.
What they do with them there on methadone, they will put them on maintenance methadone if they want, but they prefer to put them on 3 days of methadone, 25, 15, 10, and 5, wean them down,
right,
so they don't suffer too much coming off of the heroin, and then they're heroin-free and no more methadone. It works very well.
How did you end up, and David Edgar Love, you've been active in shutting down the Scientology drug program, Narconon. How did you end up at Narconon?
I ended up at Narconon from Vancouver because my daughter was... She went there for treatment, and as usual, they recruit the patients onto staff when they graduate the program.
Right.
With no qualifications, of course. So she was the ethics officer there. So while I was at the Vancouver Detox, I had arranged to go to a 3-month treatment after the detox. And I was prepared to go in about a week from there. And I phoned her. She says, "Well, why don't you come out here?" And I said, "Well, I have no money." And she says, "Well, let me, phone me back tomorrow." So I phoned back the next day, and she says, "Well, if you're willing to sign over your unemployment insurance of $800 every 2 weeks, they'll take that. We'll let you in at half price at $11,000.
Mm. Wow.
So I said, what the heck, why not? I haven't seen my daughter for a long time, so I flew out. And the registrar, salesperson, slick as a snake, sent all the particulars, a 76% success rate, something that came right down from heaven for most people when they see that. So I thought, I looked on their website, didn't see anything about Scientology or nothing, so I flew out there. Boy, was I in for a surprise.
76% success rate. Where did they get that number from?
I think they pulled it out of their, where. I mean, they advertised 76 to 90% success rate.
But there's nothing to back it up.
Absolutely nothing at all. As the graduate officer that I was after I finished the program, and they were paying me $100 a week for working 16 hours a day, basically. They hired 5 of us all at once. It was my job to calculate the success rate, so I would call and email the people that had left the Narconon program, and the numbers were coming back under 40%. And when I added up how many of the staff that were working at Narconon that were still using drugs down at the staff apartment complex, it dropped down to about 20%. Well, even 20% is high.
Now let me go through this, because when you were working there, literally you go through the program and you join staff as what?
As whatever you choose. You can be the ethics officer. You can be a course room supervisor. I was a course room supervisor. I was the graduate officer, and I was also a registrar, the one that is the person that follows the leads when they call in the 800 number or fill in the little box on the fake websites, and you call them and you try and get them in.
Yeah, but wait a sec here. I mean, I'm a certified addiction counselor. I mean, how many people like me would be employed there?
None, not one.
So, in other words, people are going there. There's no qualified. What about medical care?
None. There's no doctor there. There's no nurse there. In fact, you go into the detox part of it, which they call withdrawal. There is no doctor. There's no nurse. You start the first hour when you get there on Scientology training routines and auditing sessions of staring and looking around the room and
yelling at ashtrays.
And no, not yet. They
okay.
give you assist. They lay you on a massage table and they say, "Feel my finger," and you say yes. They say, "Thank you." Feel my finger, and then they rub their hands down your body. That's basically it. And then you stare and you sit across from another person in a chair, and without moving. If you move or blink, they flunk you. It's 100% Scientology training routines from the hour you get there.
Now,
nothing else. There is no nurse. There's no counselors. Nothing.
My understanding, and I've got David Edgar Love here on News Talk 1010, People Helping People. David, I understand, and I know there's been a number of deaths associated with Narconon.
Yeah.
Families now saying they had no idea their kids were getting into something that was affiliated with Scientology, and they fully expected. I mean, in a lot of cases, these people were paying, tens of thousands of dollars for treatment, which they thought was going to be, medical, professional treatment.
Right.
Is there any professional treatment at all?
Absolutely none at all. I mean, even if you want to see a counselor outside or a psychiatrist or another doctor besides the Scientology doctor that they had in Montreal, when you're in the withdrawal unit, they take you every Wednesday, if you're well enough. They travel for an hour and a half to Montreal. There was a doctor there who was a Scientologist. I did file a formal complaint with the College of Physicians in Quebec, who investigated him for 6 months and banned him from ever associating with Narconon again, stating that it was not recognized in Scientology current literature, and he was never to attend or see any patient from Narconon again. So Narconon was in big trouble. They couldn't use any doctors from Quebec.
Wow. Then the thing is, though, that you get people, and if they are like you and they're coming off of 180 milligrams of methadone a day, literally, if they don't have a medical detox, they'll die.
They will die, and this is the problem. Even severe alcoholics that were at Narconon were taken away in ambulances because they weren't even given the simple little drug called phenobarbital that will help them not going to seizures, epileptic seizures. I had an epileptic seizure while I was there, and I wasn't even taken to the hospital. But some were so bad they were taking them away in ambulances.
Now I've seen you on NBC News. I've seen you on CNN. I know you've been doing an awful lot of publicity. You've really made this a cause to try and get Narconon shut down. Period. And how successful have you been so far?
Well, I just keep plugging away. I did fly down to Oklahoma to meet the parents of the deceased young children. I went to a protest down there, a very large protest. I flew to New York to be on NBC Rock Center to do the Narconon program. But down in Oklahoma, we did a real big protest. And I did deliver a lot of documents to Senator Tom Ivester to help him with some legislation that is taking effect, I think, next month to perhaps shut down Narconon Arrowhead, at least help. I did meet with the ministry, the mental health ministry in Oklahoma, and I did meet with the FBI in Oklahoma.
Now, what about here in Ontario? Let me pull this close to home, because recently...
we did a lot of work in Ontario, yeah.
Recently, Scientology Narconon tried to buy a piece of property in the Hockley Valley. They got shut out by the neighbors. The neighbors hit the roof when they found out what was coming in. Now I understand they're seriously talking about opening a treatment center in Cambridge, Ontario. Yes. Is there anything that will stop it? Yes, absolutely. I was contacted right away by the Hockley people, and they were proactive in putting signs up and having town hall meetings. Scientology sent their best, the best they had, Clark Carr from California, Yvette Schenck, and also Brad Melichuk from Canada, to try and sway the people of Hockley, but they didn't want any part of it, none at all. So they didn't really have a chance in Hockley. Even if they had have opened it, there would have been continual protests to shut it down. No, they do own a large property in Orangeville.
Yes, they do, and that's for a Scientology retreat, which will probably remain mostly empty most of the time. I just traveled to 27 cities in the United States filming a documentary with Bert Lee and Colin Henderson in August. For 14 days, we worked 16 hours a day. 80 hours of film we got. We went to all the Scientology churches and organizations of Scientology we could, right from Texas right up to New York, back down to Oklahoma, and or Oklahoma up to New York, back down to Texas. 27 cities, and the ones we filmed, they're empty. There's nobody there. So even this one in Orangeville, Canada, it's going to be empty. There's hardly any members left. They're leaving in droves.
Let me ask you this: is there any kind of organization to push to get them shut down in case, and here I have to wonder, here in Ontario, we have no real regulation regarding rehab centers unless you are affiliated with getting government money. Literally anybody can open a treatment center. They don't have to have anything, as long as they meet the local building codes. There's nothing medical. There's certainly no legislative, no legislation that's going to stop anybody from opening a treatment center, and many have.
That's true.
Is there anything that people can do to lobby?
Yes, there is, and the people from Hockley have written to some people as high up in government as they know and can. There's a doctor in the Cambridge area right now who he is in contact with me several times a day right now, and he's keeping on top of this. And I have filed 2 submissions to the College of Physicians in Ontario, because there is 2 powerful doctors in the Toronto area that are Scientologists. This is where we got the biggest problem right now, is these 2 doctors. And yes, Ontario does not have the regulations, and they need the regulations that Quebec now has in place. Can we get it done? Well, I've petitioned the Liberal candidate, Justin Trudeau, and his advisors, and Friday High, Liberal in Vancouver. And I think we're going to have to go the political way, and then we're going to have to go as strong and powerful as we can. I think that's the only route, the media and the government, and just push it as hard as we can.
David Edgar Love, I've got an article from the Village Voice in front of me, headline, David Edgar Love, I think I have Scientology by the balls.
Oh, my God.
Do you? Do you?
Well, that's Tony Ortega. He's one of my dear friends. I've met him a couple times in the United States. He's quite a writer. I was very tired. Narconon Trois-Rivieres just got shut down that night, and he was interviewing me. I was exhausted with all the TV interviews that day, And he asked me a question. I says, well, with the Human Rights Commission cases that we have right now in Quebec and the case precedents that I presented from the Supreme Court of Canada to the Commission, I said, I think I have Scientology by the balls on this case, because we're going to get a decision within about the next month. And here he puts it up for a headline, and the next morning I'm thinking, oh my God, this is so embarrassing, but so be it.
All right.
He's a good writer. He's a very good writer.
David Edgar Love, I follow your travels with interest. I'm certainly grateful to have you on the show. It's great meeting you. I appreciate you being here, and thank you for joining us. Join us again, won't you?
Yes, I'll join you again. Thank you very much, Mark. And everything you've said tonight so far, you've been right on the button. It's an epidemic, the addiction right across Canada and North America. It is staggering. It's scary. And you've asked a lot of questions that I hope people think about tonight. What can we do about this?
Well, look, David, I appreciate it. Keep up your good work, okay? Thanks a lot.
Thank you very much. Have a good evening.
God bless.